Thank you so much, Maude, and thank you to everyone that took time out to join us today for this latest update. Today, we are going to be talking about what the national conversation has essentially turned to. Everyone is really eager to get back to work and to reopen the economy. So one of our topics today is going to be the emerging reopening framework for the state of Oregon and the latest iteration of the CARES Act, which passed last Friday and then began on Monday. It's called the Enhancement Act. So on the next slide, just a little bit about the Caputo Group. We offer complete support services for your small to mid-sized business in the areas of human resources, compliance, payroll, benefits, and liability. And that way we give your small business, big business expertise. And additionally, we conduct activities like this to help support your business through the changing landscapes that affect business today. So on the next slide, let's go ahead and get started. We're going to give a brief timeline of the federal coronavirus response. On March 6th, H.R. 6074, the Coronavirus Preparedness and Response Supplementary Act, was passed. This was the initial step taken to appropriate $8.3 billion for vaccine research and also for administration needs in terms of funding what would be the next steps. On March 18th, H.R. 6201 was passed, and that's the Families First Coronavirus Response Act. And that was the law that mandated paid sick leave, extended medical and family leave. That act also expanded unemployment insurance to cover groups that weren't previously covered by unemployment insurance, and it also expanded food benefits. At the end of March, on March 27th, H.R. 784 was passed, and that was the CARES Act. And that is the Coronavirus Aid, Relief, and Economic Security Act. This is the act that proposed the Paycheck Protection Program loans and the Economic Injury Disaster loans that are both administered through the SBA and are designed to help small businesses stay afloat during this crisis. The PPPLs, as we've talked about in previous webinars, were available through SBA approved lenders, while the EIDLs were directly through the SBA. So that program also authorized direct payments to citizens. So a lot of US citizens have already gotten their $1,200 stimulus checks from the IRS. It also proposed the program of employer tax credits as ways that employers could get tax credits for compliance. And then, as we all knew, the funds for that program were exhausted on April 17th. So there was a bit of a shadow period there. On the next slide, I want to just show you some emerging SBA statistics. From April 3rd to the 16th, nearly 5,000 lenders approved over 1.6 million SBA approved loans, totaling over $340 billion. The maximum loan amount is $10 million, but the average loan size was about $206,000. And here are just some of the industry subsectors that received the most PPPLs. At the top of the list is construction. Then we have professional, scientific, and technical services, manufacturing, healthcare and social assistance, accommodation and food services, and finally, retail. Like I said, that program quickly ran out of funds, and a lot of you probably heard through the news or other forms of the grapevine that certain businesses who really shouldn't have been dipping into that pot dipped into it and then were compelled to return the funds. So that also led to a revamping of the oversight guidelines by the Treasury Department and the SBA as well, to ensure that the next wave of appropriations would be spent according to their original intention. So on the next slide, we have an overview of the Enhancement Act. As you can see, it was signed into law last Friday on April 24th. It appropriated an additional $310 billion for the Paycheck Protection Program, an additional $60 billion for the Economic Injury Disaster Loan Program, $60 billion for smaller lenders and unbanked industries, $75 billion for hospitals, and $25 billion for testing. The lending resumed this week, Monday, April 26th. And some of the main points about, yes, the slides are available. They will be on our website afterwards. So there's no need to resubmit your application. If you've already submitted an application for either one of these loan programs to the SBA, there is no need to resubmit your application. Under the new guidelines, hedge funds and private equity firms are not eligible for this program. And applicants now, there are more strict regulations. They must be able to certify that their loan request is necessary to keep their business afloat during the current crisis. And so I've included a link here for you, the SBA interim final rules that have been updated just a few days ago. So you can go ahead and use that link to access that. And then just yesterday, the Treasury Department updated the frequently asked questions about the PPPL, and you can access that FAQ at that URL. So on the next slide, we are going to pivot now to a question that is on everyone's mind. What does reopening look like for the state of Oregon? And I want to preface what I'm going to say today by acknowledging that a lot of this guidance is still emerging. What I've curated for you today is based on direct documentation. I got on a call with Governor Brown. It was a webinar last week where she talked about this. And I've also been looking at what various counties around our state are proposing as they're opening guidelines. The state of Oregon's guidelines definitely depart from the federal guidelines that have been set forth by the White House. So I'm going to talk to you about that. First of all, Governor Brown, along with the governors of Washington, California, and now Nevada, they, I'm sure you've heard that they've formed a pact, and they have agreed that the openings are going to be data-based and fact-based. And so there is a big emphasis that is being put on the collection of data. It's not going to happen overnight. It's going to be an incremental opening, and it's going to happen county by county. And rural counties are expected to open first. If you look at the overall coronavirus map of the state of Oregon, you will see that some of the rural counties had 0 cases, and 0 deaths. And so I dare say that some of the rural counties, you know, with they certainly don't have the population density that we have in other parts of the state. They, you know, they kind of live with social distancing anyways. So as of April 18th, 8 counties have petitioned Governor Brown for permission to open most non-essential businesses. And here are the counties that have petitioned the governor. So the criteria for reopening. In order to begin the first phase of reopening, a county has to be able to show a declining growth rate of active cases for 14 days. They need to be able to certify that they have sufficient personal protective equipment for medical personnel and first responders. They need to demonstrate their ability to surge to ICU capacity. They need to demonstrate increased testing capacity, contact tracing, and isolation of positive cases. And they have to show that they have a strategy in place to protect vulnerable communities. So on the next slide, we'll just have a look at where we are now. And I've called that ground zero. So the whole objective of the social isolation, the social distancing policies that have been in place is to slow the spread of the virus and to give us time to scale up our health infrastructure. We've seen schools close, malls and non-essential retail has closed, gyms, churches, and theaters have closed, and personal services have closed, which personal services include salons, massage, lawyers, had a list here of personal services, attorneys, accountants, those types of businesses. Businesses that have been open on a limited basis are restaurants, cafes, and bars, which have been encouraged to pivot with delivery and curbside pickup. Dispensaries and liquor stores have been deemed essential businesses, and grocery, obviously, and some retail like hardware and garden supply, and then obviously the healthcare providers are also essential. So the conditions of this phase have been that we shelter in place, that we telework where possible, that we practice social distancing and using of face coverings and masks in public, and then there has been a ban on non-essential travel. So moving forward, here are the gating criteria that that the state of Oregon is looking at in order to determine whether or not we're going to move on to phase 1. So we talked about the 14-day decline, and we are still waiting. So if we could just move on to the next, there we go, thank you. So we're still waiting on clarity in terms of from what date are we looking for that 14-day decline, and I certainly visit their website every day to see if anything has changed. As of this morning, we still don't have clarity on that. Again, the local hospitals have to demonstrate an ability to treat cases without resorting to crisis care standards, the ability to surge ICU capacity when needed, and adequate personal protective equipment. The testing capacity is a huge issue, not only for our states, but for many states nationwide. Ideally, the testing capacity should demonstrate the ability to serve anyone with symptoms. So Oregon, as of yesterday, was reporting that it currently tests at 15,000 tests weekly. That's the capacity, sorry. But Oregon's only testing at about 9,000 a week, and that's from the Oregon Health Authority. The ideal capacity for the state of Oregon is triple that, so it's 45,000 weekly test capacity. And we are also still waiting on guidance and clarity regarding our testing capacity. Another factor that needs to be put in place is the active monitoring and contact tracing. So one of the things that the Oregon Health Authority has spoken about is that it is in dire need of personnel. They are looking to hire about 600 people to be able to administer the testing and the contact tracing. So that's a big hurdle that they're jumping right now. But let's have a look at what phase 1 would look like on the next slide. So during phase 1, vulnerable groups would continue to self-isolate. You can start to get together with your friends, but you can't have a party with more than 10 people. You would minimize non-essential travel, and we're still waiting on guidance for, what exactly constitutes that and what would be the penalties for not minimizing non-essential travel. You would continue to prioritize telework, although you can start to trickle back to your offices. We would continue to practice social distancing and the use of face coverings in public. And there would be a continued closure of areas where people could possibly congregate, such as playgrounds, town squares, those types of areas. So on the next slide, some of the businesses that can start to reemerge during phase 1. So with sit-down dining, I've heard two different things. I've heard that it will be allowed to return at 25% capacity, and then I've heard conflicting reports that it could return at 50% capacity, and I will continue to chase after that clarity for you. So the proposals are that strict social distancing in restaurants and strict hygiene protocols would be enacted. And we're still awaiting, the guidance on that and the formation of the work groups that are to propose plans for that. Some things that have been suggested for restaurants have been every other table, or arranging your chairs in such a way that you have less people per table, spreading out into outside areas surrounding a restaurant, and so on and so on. I have been chasing after associations like the Accommodation and Restaurant Association to get their feedback on this. I haven't been able to be in touch with them yet, but I will continue to keep my ear to the ground for that type of information so that we can get clarity on that as soon as possible. Bars are a big maybe for phase 1. There is a study group, a work group that's working on that as well, and I am right at the door waiting on that guidance to bring that to you as soon as possible. Some childcare, again, waiting for guidance, what types of childcare and under what types of conditions. The personal services will be able to open with strict social distancing and hygiene protocols. We're still awaiting guidance for that. And the work group is in formation, so we'll see what happens with that as well. Again, it's the work groups that are being formed that the governor is consulting with are sector specific. So I'm going to be very excited to find out what the different guidelines are for the different sectors as they come out. As of tomorrow, however, non-emergency medical procedures can restart in the state of Oregon. So that's a good step in the right direction. So on the next slide, here are some additional requirements that counties will be expected to comply with as they petition the governor for permission to open up their counties. They will need to provide a letter from the county hospital chiefs committing to daily personal protective equipment reporting to the Oregon Health Authority. They will have to certify the reliability of their personal protective equipment supply chain, and they will have to certify that they are able to surge their hospital bed capacity. They will be required to provide a letter of recommendation from the county public health officer, and there will have to be a vote of the county governing body certifying sufficient personal protective equipment for first responders. So there's an additional paperwork that each county is going to be expected to provide when they petition the governor for permission to reopen. So in our next slide, while this is all in limbo, for employers, what can we do? So employers are going to have to start to liaise with their associations, see what their associations are passing down, and they're going to have to start developing and implementing policies consistent with the guidelines that are going to be coming out. And that has to do with social distancing, personal protective equipment for employees and also for patrons, whether they're going to require that for patrons as well. Definitely enhanced sanitation is going to be a big deal for a lot of businesses. Salons, massage places, restaurants. They're going to be monitoring their workforce for symptoms. So that's also going to be woven in. And then they're also going to have to contend with contact tracing. So what I understood from Governor Brown, listening to her talk, is that each phase is going to be gone into based on a set of criteria like what we've seen. And then that situation is going to be monitored to see if there is a resurgence. If there isn't a resurgence, then we would go on to the next phase. If there is a resurgence, then on the next slide, we see that we would have to return to the restrictions of the previous phase. And then we would activate the disease surveillance system. And this is still in formation. So again, widespread, fast, easily accessible testing, scaled up contact tracing and quarantining. And there has been talk of the possibility of having actual quarantine centers. So I will keep following up on that detail too. And here again, the ability to surge is very, very important. And that also goes along with rapid reporting to federal, state, and local public health authorities, and the implementation of adequate technology and personnel for fast data entry, reporting, and support also for the quarantined. So in order for this reopening to be based on facts and data, one of the hurdles that has to be jumped is in the actual fast collection, entry, reporting, and circulation of that data. And that is a hurdle that the state of Oregon has admitted to facing. So on the next slide, we look at what phases 2 and 3 would look like. I know that, you know, at this stage that we're at right now, that might sound like going forward too quickly, but I'd like to just at least show you, map that out and see what that would look like. So phase 2 means that gatherings can increase to 50. So non-essential travel can also resume. Schools and gyms would be opening with strict social distancing and hygiene protocols. Bars would open if they don't open during phase 1. Remember, there's still a possibility that bars could open during phase 1, but the work groups are still out on that. And then we would start to incorporate sports venues, churches, and theaters, also with strict social distancing and hygiene protocols. In phase 3, mass gatherings could increase in size. Work sites would no longer restrict their staffing. Visits to nursing homes can resume, and seating can be increased in restaurants and bars. On the next slide, I just want to let you know that according to Governor Brown's office, a complete reopening framework is expected next week. So I hope to be one of the first to get my hands on that and digest that and be able to pass it to you through our next week webinar. The sector-specific discussions around reopening began on April 20th, and the high-level framework presentations began on April 17th. And I just gave you a list there of some of the councils and sectors that are liaising very, very closely with Governor Brown's office to provide the frameworks and the SOPs for opening for all of those different sectors. So on the next slide, I just want to let you know that next week we will continue with the ongoing saga of the economic stimulus and give you the updates on that. I will bring you further developments in the reopening plan, and I hope to bring you requirements for workplace compliance for phase 1. I've checked with OSHA about that. And they are also still waiting on guidance. So it's, you know, this particular week is still one of those limbo weeks where there's so much that's still coming out. But at least we know what to listen for and what to look for. And then on this next slide here, I've just resumed the links for you. So your coronavirus relief options from the SBA, you can go directly to that link and it'll take you to the page where you can get the Paycheck Protection Program application, the EIDL applications, and there are some other options there for you as well. The SBA interim final rules is a really good document to download and have a look at. That is their latest iteration. The Treasury Department updated frequently asked questions on the PPPLs. That's updated as of yesterday. And then of course the Oregon Health Authority and the CDC, who are working very, very closely with Governor Brown's office and advising her on reopening protocols. So that is it from me this week. On our last slide, I just want to remind you that, you know, at the Caputo Group, we can give you a free consultation about how your business could potentially manage mandatory employee sick leave, and also let you know once again that this presentation, including a copy of this slide deck, is available at that website that you see right there, www.caputo-group.com. I appreciate all of you joining us today, and we are happy to take questions.
Sophia, thank you. thank you so much for all of your great research and information. This is, I think, one of the most interesting pieces for folks right now is what comes next. And I think it's very challenging to find those answers. So thank you for trying to pull as many of them together for us as possible. Thank you very much.
Oh, thanks, Maud. Yeah, it's funny because, like I was saying, one of the phrases that I've used most this past month and a half is "we're still waiting on guidance."
Absolutely.
Literally, the situation does change very rapidly.
Yeah. So at this point in time, if anyone has any questions, again, you're more than welcome to ask it in chat. If you would prefer to ask it anonymously, you can definitely send that question to Maud with the Caputo group privately, and I'll ask it for you. And at this point in time, you all have an opportunity to unmute yourself if you would like to ask a question. One that came up, Sophia, and I don't know if there's even an answer for this, but in your research, looking at the more rural counties that are perhaps going to open up first, have they provided any guidance or commentary on how to handle potential folks kind of flooding into a rural county from perhaps other counties?
That is a really good question, because some of these counties that rely on tourism are probably going to see a real influx on that. I will definitely keep my ear to the ground and try to find that answer for you.
Thanks, Sophia. Does anyone else have any questions or comments, things that have been working for them at all? And again, if you would like to unmute yourself, you're more than welcome to do so at this point. But yeah, I think we'll kind of open it up for questions for a little bit longer, but maybe, Sophia, maybe you were just very thorough.
Yeah, unfortunately, I feel like right now there's more questions than answers, but at least the questions can guide us, and they can help us map out the way forward. I am getting the different counties reopening plans as they come in, so I plan on studying those during the next week, and hopefully I can have a better resource for people next week as those plans start to emerge from the counties.
Fantastic. Thank you so much, Sophia.
Thank you too, Maud.
Thank you again, everyone, for dropping by. We absolutely appreciate it. We hold these every Thursday. And Sophia, thank you again so much for all of your hard work gathering this information for us.
Oh, Mark's here. Hi, Mark.
Well, Mark, thanks for joining us.
Thanks for being here, Mark. Janice, Alex, thank you all.
Well, thank you again, everyone. I hope you have a wonderful and healthy day. And I think, Sophia, if you have any other additional pieces to add, we'll make sure to put this up on our website, and so that it's accessible for folks from there.